Dr. Quick, we're live. You may begin.
Good evening, everyone, and welcome to tonight's virtual town hall on the post-fire air, soil, and water assessment plan. I am Dr. Nicole Quick, Chief Medical Advisor with the Los Angeles County Department of Public Health, and I'll be serving as your host and moderator this evening. I want to begin by offering our sincere thanks to our federal, state, and local partners who have worked hand in hand with us on wildfire recovery. Special thanks to Supervisor Catherine Barger for her leadership and advocacy on behalf of fire-impacted communities, and to our partners and many others who continue to support impacted schools, neighborhoods, and communities. Tonight, we'll hear from public health leaders, scientists, and mental health professionals who will walk us through the work being done to assess the health and safety of our environment in the aftermath of the recent fires. That includes updates on air quality, water and soil testing, the results we've seen so far, and what they mean for you and your family. We'll also cover important next steps, how long testing will continue, what we're looking for, and how we're using this data to inform reopening decisions, cleaning strategies, and long-term safety measures. The post-fire assessment plan is a collaborative effort between LA County Public Health, environmental scientists, academic researchers, and our state and local partners. This plan includes air monitoring for particulate matter that can impact respiratory health, soil testing for heavy metals and other contaminants that may have settled in outdoor spaces like playgrounds and yards, water testing to ensure drinking water sources remain safe, indoor assessments in classrooms and common spaces to detect volatile organic compounds or any indoor pollutants of concern. This work is happening in phases, with new data released regularly and posted to our dedicated wildfire safety webpage. We've created tools that allow community members to look up results by location, type of contaminant, and testing agency. Our commitment is to ensure that communities are making decisions based on best available science and that residents feel informed and reassured each stage of this recovery. We also want this to be an interactive event. After the speaker presentations, we'll move into moderated Q&A. If you have a question, you can submit it at any time by typing it into YouTube chat or by commenting directly on live stream on Facebook or X. Our team is actively monitoring those platforms and will bring your questions into the conversation. Tonight's town hall is also available with live Spanish interpretation at 1-800-805-1150. To kick us off, I am honored to introduce Supervisor Catherine Barger, who represents the 5th District on the Los Angeles County Board of Supervisors. Supervisor Barger has been a powerful advocate for impacted families and communities, working to secure resources, improve coordination, and ensure the public has access to timely, clear, and transparent information throughout this process. Supervisor Barger, thank you so much for being here with us tonight.
Good evening, and thank you, Dr. Quick, for your leadership and for supporting the important work. And actually, thank you to your entire Department of Public Health team who have been laser focused on addressing the health concerns raised by constituents impacted by these fires. To all the residents who've joined us tonight, thank you. Your presence here speaks of your deep commitment to your families, your neighbors, and to our wonderful community. I appreciate you taking the time to engage in dialogue and hear directly from experts working on your behalf. I know many of you have reached out asking for transparency, answers, and action. You've advocated for this forum, and I want you to know I hear you. As your supervisor, my commitment is to ensure open and honest communication between residents and all of our county health agencies. Recovery doesn't end when the flames are out. The true impact of a fire lingers in the air we breathe, the soil beneath our feet, and the water that we all rely on. Families deserve to know what's in their environment and what's being done to protect them. That's why I've been in close contact with the Department of Public Health and other agencies pushing to ensure that testing is thorough, assessments are swift, and that we're not just providing information, but we are delivering solutions. Transparency really is the key. Every step of this process must be clear, and every concern must be met with real answers. Tonight's town hall is part of that commitment. The assessment plan we're discussing isn't just a list of tasks. It's about people's lives, health, and their peace of mind. As we go through the findings, what we know, what we are still working to uncover, and the steps ahead, I want you to know this, that you are not alone. We are here, we are listening, and I am committed to leading with action. With that, thank you all for being here. And again, thank you to all the presenters tonight. I think it's important that we provide our constituents with answers. And when we don't have the answer, I promise you this, we will find it and we will provide all the information requested. Thank you.
Thank you so much, Supervisor, and we remain committed to working with you through this process and very much appreciate you here tonight. Next, we will hear from Dr. Anish Mahajan, Chief Deputy Director at the LA County Department of Public Health. He will share the findings of the county's Rapid Needs Assessment Survey conducted after the fire. He'll walk us through what the data revealed and how it is guiding our public health response. Dr. Mahajan will also introduce our next two speakers from the Department of Mental Health.
Yeah, thanks so much, Dr. Quick. It's an honor. It's an honor for us in the LA County Department of Public Health and all of our partners to be in service of you all. Thank you for joining us tonight. I also want to thank Supervisor Barger and her team who have been extraordinary in their leadership and support of us and guiding us in how we can help with recovery. If we could go to the first slide. Thanks so much. As Dr. Quick mentioned, there was a rapid needs assessment conducted that was done electronically and directed to individuals who lived in the fire areas at Palisades and Eaton and those who lived just outside of it. This was a rapid needs assessment electronic survey that was developed by the LA County Wildfire Recovery Health and Social Services Task Force. This is essentially one of the task forces that the County Board of Supervisors and our city partners have assembled that includes government agencies, state, federal, and local agencies, as well as community-based organizations, other healthcare delivery systems, and university partners to help address the recovery needs of our impacted communities. The specific rapid needs assessment that was designed by our task force was to understand what our affected communities needed to recover. And so by understanding what was needed, then to really design and direct resources and support to the most significant needs that were identified. This was a survey from February 19th to March 10th, and it was made available in multiple languages that we know were prevalent in the Eaton and Palisades areas. There were a total of 1,468 Eaton Fire survey responses by individuals who were impacted by the Eaton fire, and another 838 from the Palisades fire side. We looked at the demographics, or like the types of people who responded to the survey in both the Eaton area and Palisades area, and noted that it matched reasonably well with what we know is the underlying population and how the population is in these areas. Let's go to the next slide, please. These are just some very summary level findings. There's a lot more detail that will be provided to the public on the website, and we'll be putting out a more detailed report in the next 1 or 2 weeks. But I wanted to highlight just some of the things that we saw in the needs assessment. Under the topic of housing, and this won't come as a surprise to those of you who have joined us tonight, you all helped respond to this and are grappling with these challenges I'm about to go through. 60% of the Eaton fire respondents and 55% of the Palisades fire respondents are displaced from their pre-fire home. Among those displaced, 38% of Eaton fire respondents reported it's been difficult to find a safe and stable place to sleep at night. And 84% of the Eaton fire respondents who are displaced are still living in LA County. 21% of the Eaton fire respondents do not have homeowners or renters insurance. Some of the needs that Eaton fire respondents told us about are under the blue heading on the left lower part of the slide, included getting their homes cleaned or repaired, getting an air purifier, debris removal, and certainly help with rent and mortgage payments. Let's go to the next slide, please. Under the heading of health, the top health need was finding mental health support or counseling. Nearly a quarter of respondents from the Eaton Fire area indicated that this was their top need. 31% of the Eaton Fire respondents said they do not have or are unsure if they have a place to go for mental health care, and 77% reported that they had worsening mental health since the fire. Our heart goes out to all of you impacted by the fire. These statistics won't surprise you, but they show us how important it is for us to make sure we connect the dots and get folks the help they need, which is why in a moment or two, I'll be introducing our colleagues from the Department of Mental Health and other partners who are going to walk us through some of the ways in which community residents impacted by the fires can seek the support they need for wellness and mental health care. 59% experience worsening physical health, and 74% from the Eaton Fire have health concerns about themselves or their household being in or nearby areas that were burned. And we're going to hear a little bit later tonight from some of our environmental health experts about how to assess the risks related to that last point. Let's go to the next slide, please. There were a lot of financial and other needs identified in the survey. Some of the top financial needs was paying for lost belongings. Nearly 45% of Eaton Fire respondents indicated that was their need. Covering costs for rebuilding or repairing home or property, 37%. Covering daily living costs other than rent or mortgage, 29%. When asked what were their most needed essential goods, safe drinking water was among the highest indicated needs. Household cleaning supplies, bedding or sleeping essentials. 35% reported needing help knowing where to go for reliable information, and 41% of respondents felt overwhelmed by having too much information coming at them, and 33% didn't know what services were available. These data and much more are being shared right now with the relevant groups that are working on these things. And so next, what I'd like to do is just toss it to my colleagues in the Department of Mental Health, Dr. Curly Bonds and Miriam Brown, ask them to quickly introduce themselves and take the baton from me to talk about what are the mental health services that are available. I'll also mention that we're joined tonight also by Alter Behavioral Health, which is another entity that has come to help with disaster mental health response, and they're also available to help answer questions. Let me turn it over to Dr. Bonds. Please go ahead.
Thank you, Dr. Mahajan. I'm Dr. Curly Bonds, and if I could get the first slide, I want to introduce also my colleague who's accompanying me, Miriam Brown, who is our Deputy Director for Emergency Outreach and Triage Services within the department. Next, please. As Dr. Mahajan pointed out, 25% of residents who were affected by the fires felt that it was difficult to get mental health, and they had that as a top need. And 77% reported worsening mental health. So we see it very important that we first define what mental health is, because it's not something that's at the top of our mind for those of us who haven't received services before. It includes emotional, psychological, and social well-being, and it can affect how we think, act, and feel. It also determines how we handle stress, and certainly with the fires, there's been no shortage of that, and also how we relate to others and how we make choices. Next. Mental health is very important because after a disaster, like we experienced with the recent fires, people experience a variety of reactions, some of which are natural in response to disaster and difficult situations. The things that we heard about are displacement, financial uncertainty, fears related to an unsafe environment, including drinking water. So those things all need to be addressed, and in some ways, it's best to engage with a professional or some type of mental health support. Next slide. This is a slide that may be difficult to see, but it goes over some of the resources that are available. The Department of Mental Health has been on the ground since the beginning. We were deployed to the evacuation shelters, and after that, when people were re-entering the zones that had been affected, we had staff there, and people were noticed to have all kinds of different emotions. Some felt jumpy, irritable, angry. There were some who felt guilty, numb, and of course, sadness just at the enormous amount of loss and grief. If you have trouble sleeping or have difficulty managing emotions, there is help. The most common way that people seek our services is by dialing our helpline. The number is displayed here, 1-800-854-7771. And we're also available on all the typical social media platforms, Instagram, Facebook, and X, if you just search for LA County Department of Mental Health. We also offer, in collaboration with our partners from the Substance Abuse and Prevention and Control Division of the Public Health Department, resources for substance use services, because some people found that their addictions were a little bit more difficult to manage in the face of the fires. Alter Behavioral Health is a partner that is providing free services to those individuals, both who need crisis support, one-on-one counseling, and also to connect individuals to essential resources to facilitate their recovery. This may include support groups and also disaster preparedness training so that we're ready for the next disaster. If someone has serious symptoms and maybe wants to end their life, the Suicide Crisis Line and Lifeline is also available. The simple number to remember and put in your phone is 988. It's essentially the number that you call when you suspect or know someone who's experiencing a mental health emergency that puts their life in jeopardy. Other resources for community members are managed care plans. If you have one of those, the numbers are displayed here. Those are our partners like LA Care, HealthNet, Kaiser, Molina, etc. And then Cal Hope also offers free, confidential, and emotional support services. This list is not exhaustive, but we also have SAMHSA. They have a disaster stress helpline that's at the federal level, and the Veterans Peer Access Network for those who are members of the military or military affected families. So those are just a high level overview of what we have to offer. And I will ask Deputy Brown if she has anything to add.
Good afternoon. My name is Miriam Brown with Department of Mental Health. I'd just like to invite the community to seek the resources, give us a call. We have a wide array of services to provide you in the community. Or if you just want to make a phone call and speak with someone over the phone, our DMH helpline or the 988. You don't need to have somebody in person. You don't need to disclose any information. It's confidential, and we offer services in multiple languages. Thank you.
Thank you. Back to Dr. Quick.
Thank you so much, Doctors Mahajan and Bonds and Deputy Brown. That was very useful information. We do have some questions for you that we'll get to during the Q&A section. And next, I'd like to introduce Dr. Payam Pakban, who is the Atmospheric Measurements Manager at South Coast Air Quality Management District. He will be providing an overview of the recent air quality and environmental monitoring results and explain what they mean for residents living in and around the impacted areas.
Good evening, everyone, and thank you so much for the introduction. I will be giving you some information about the air monitoring activities that we have as part of our expanded air monitoring. This includes both continuous hourly measurements of particulate matter, both in PM 2.5 and PM 10 ranges. These are hourly measurements at 3 locations in Eaton Burn Scar and 2 locations within the Palisades Burn Scar. And these are reported on our website. Our website, I believe, will be shared. The link will be shared in the comments section. And I will share my screen to walk you through that. This is our website dedicated to the wildfire response air monitoring activities led by South Coast AQMD. There are many resources here, including our air monitoring in Eaton Burn area as well as Palisades, which I'm going to walk you through those. However, you can also find information about our mobile monitoring surveys during phase 1 cleanup, some information about regional air monitoring, precautions and recommendations for local residents, and other resources. But today I wanted to show where you can access and visualize air monitoring data. If you select either Eaton Air Monitoring or Palisades Air Monitoring on this web page and scroll down by clicking on this screen, It takes you to an interactive data dashboard that provides data access. These are the 5 sites where we're doing and conducting our air monitoring. Depending on which site you're interested in, you can click on the site. It opens a pop-up, and by clicking on link to the data, it provides you access to air monitoring data. This is particulate matter, smaller than 2.5 micrometers. This is PM 2.5. We're reporting hourly data as well as 24-hour data. This is the current measurements for the previous hour and previous 24-hour. If you want to look at trends, there is a button here that shows you a bar chart showing the hourly measurements in the past couple days. You can do so as well for the 24 hours. And there is an option here that you can compare these measurements with federal standard for PM 2.5. So far, our 24-hour average PM 2.5 concentration levels at all of the 5 sites for the duration of measurements remain below federal standard. You can do the same for PM10, which are larger particles typically associated with dust. Again, you can look at the hourly measurements, and you can look at past 24-hour measurements, and you do have the option to compare the measurement results with federal standard as well as California standard, which is a little bit lower than the federal standard. All of the 24-hour measurements for PM10 also remain below both state and federal standards. As I mentioned earlier, we also collect 24-hour samples once every 3 days at all of the 5 sites. These are filter samples. We collect those samples for 24 hours and then retrieve those samples, take it to our chemical analysis, and then report the air toxic metals as well as other elements and metals. Typically, because the chemical analysis and reporting takes some time, the results of this sample collection is posted on our website approximately 1 week after collection. If you're interested to look at those results, you have to scroll down, and then you can see this plot where all the measurements are shown for the metal of interest. If you're interested in different metals, there's a drop-down menu, and you can select the metal of interest if you want to look at it. For example, here I want to show lead, and you can look at the concentration levels. You may notice there is a hashed area. This indicates our typical background levels based on other studies that we've been doing, long-term studies that we've been doing in Los Angeles Air Basin. All the metal concentration so far has been within background levels in all the 3 sites in Altadena. However, occasionally some air toxic metals were above background levels at sites in Palisades, but levels were significantly below health thresholds, indicating no immediate health impacts. We also collect 24-hour samples for asbestos. These are also taken to the lab, and results are posted approximately 7 days after collection. In order to find the results for those, you have to scroll down further down, and you will see all the measurements are shown here in this table. So far, asbestos has only been detected on March 5th at 2 sites in Altadena, and on March 11th at 1 site in Palisades. And all other samples have been below detection levels. This concludes my presentation. You can find a lot more information by visiting our website.
Thank you so much, Doctor, for going through that in depth. I think that's really useful to show community members how to get in and really look at the data to answer some of the ongoing questions we have. So appreciate that very much.
My pleasure.
All right, next we will have Dr. Adam Love from Rue Associates, who is leading the county's representative soil testing process. He'll explain the 3-stage testing methodology, including what contaminants are being analyzed, where those samples are being taken, and when we can expect results to be released.
Great. Thank you, Dr. Quick. For those that were on an earlier town hall, I had given an initial introductory to it 2 weeks back. So this is really meant to be an update on the progress that we've made. If we could put up slides. So just to remind folks, the objective of the soil sampling study is really focused on answering the question about what fire-related soil impacts are reasonably expected based on the location and parcel conditions in both fire areas. What does that mean? We can't sample every parcel in both fire areas. So what we're doing is doing a representative soil sampling where we're testing for what has been previously, documented in other studies as being fire-related chemicals of concerns, the sort of major ones. So we're looking for heavy metals. We're looking for organic chemicals called polyaromatic hydrocarbons, or PAHs, and we're also looking for another class of organic compounds called dioxins. And we're doing those on each of the parcels that we're sampling. When I say we're looking at different parcel conditions, the parcel conditions are based on what the parcels have previously been characterized as either destroyed, as having minor or affected damage, having no damage within the fire zone, and we're looking at parcels that are outside it but adjacent to the fire areas. In addition, in the last few weeks, we've also had added to our scope to go back and sample soils for destroyed parcels after the U.S. Army Corps of Engineers has done soil and debris removal. So we're going back and sampling some of those parcels to understand what the different, change in soil conditions looks like. Next slide. So again, on the right here is sort of a map that I had showed last time that with the symbology shows sort of where the different types of parcel structures are located, with red being destroyed, yellow and green being minor and affected, and black being no damage. If we could go to the next slide. We've essentially, with that data, gridded out each of the fire areas using the grids shown. And we are sampling parcels in each of the areas where there are homes able to be sampled. Now, we started this about a month ago. We have now completed all 3 stages of our sampling. Stage 1 was of the destroyed homes and the ambient locations around the fire area. We've sampled 50 destroyed parcels and we've sampled 30 ambient parcels. Stage 2 of the sampling was for intact properties. We sampled 780 intact properties of the 3 different types that I described earlier. And then stage 3, where we've sampled from destroyed homes after the phase 2 Army Corps of Engineers soil and debris removal, we've sampled 30 of those parcels. Next slide. So just to go into a little bit more detail on what we're doing. Stage 1 is really focused on sampling the destroyed properties as a way to identify what are really the most relevant fire-related contaminants in each of the fire areas. So we went to destroyed parcels in each fire area. We took samples from 30 Palisades parcels and 20 Eaton parcels. That division is based on the fact that the Palisades fire area is larger than the Eaton fire area. And for each of those parcels, we have sampled 5 discrete soil samples and 1 sample of pure ash on each parcel. You can see the photographs, the top 2 photographs. There's an example of sort of an area where we collected an ash sample on the left and an area on a parcel that was destroyed where we collect a soil sample on the right. The ambient parcels that are part of stage 1 are really meant to understand what are the types of things that just are part of the LA County Air Basin. And so you can see the yellow circles around the fire areas are the 3 distinct areas that we've tried to capture around each fire area that represent just what is sort of normal atmospheric deposition of these fire-related contaminants, but in areas that are far enough away from the fire that we don't think there's significant contributions in those areas. And so each one, we've measured 15 parcels just to sort of get sort of what a background or ambient soil concentrations look like. And again, we took 5 discrete soil samples from each parcel. Next slide. In stage 2 is where we're assessing soils from intact parcels. Again, we've done 780 parcels, and in each one of those cells in the grid that I showed, we sample up to 10 types of each of the different parcel types that I've outlined. And again, 5 discrete soil samples per parcel. We've completed the sampling, so I can show the breakdown of how those samples are divided up in the table below. And so you can see in total, there's been 413 of those parcels are from Palisades, 367 are from Eaton, and we have a good distribution among the 3 types of parcel conditions. Next slide. And then parcel 3, again, is evaluating the impact from the U.S. Army Corps of Engineers soil and debris removal. In these cases, we've sort of taken a parcel that has been cleared of soil and debris, and we've essentially done a gridding of 10 samples across that parcel. For example, in this photo here, you can see a destroyed parcel that we're just using for an example. The grid and the 10 dots sort of represent the sort of idea of where we ideally want to take samples from in that grid. And the highlighted yellow area would be the area that we would expect the U.S. Army Corps of Engineers would have cleared based on them clearing the ash halo around structures and any debris any debris associated with the destroyed home. What you can see on this parcel is that the entire parcel is not cleared. And so there's both areas where there is soil that had been removed, and there are areas that are the original surface soil. And so we're going to be sampling from both of those locations on the parcel to understand what the fire-related contaminant concentrations look like in both of those types of situations. Next slide. And so data is rolling in, right? We've completed sampling, the data is rolling in. We expect to have at least some of the results to be able to talk about at the next town hall in a couple weeks. Our initial way of looking at this data is to first start by comparing the soil numbers that we see to both US EPA and California's DTSC's residential soil screening levels. And we're looking at that as for each sample. We're looking at that for what would it look like for a parcel. And then we're also looking at that from each one of the cells across the fire area. And then the other way we're looking at the data for the phase 2 soil and debris removal is to do a calculation from both before and after soil removal to assess what is the relative improvement that we're seeing in potential exposure and associated human health risk that's resulting from the soil and debris removal that's being performed. The graph on the right is just an example of one of the ways that we might ultimately display this data. This is called a bar and whiskers plot. And so you can see here, the red line at the bottom shows where the residential screening levels, and for this fake data set that I've used just to sort of show an example of how we might present this data, it shows the distribution of all of the data points that we've collected, where the colored bars really represent the majority of the data, and the dots represent sort of exceptions or outlier data points in the overall data set. And so for this example, right, the red bar seems to be generally below the residential screening level. The blue bar seems to be about at the residential screening level. And for the green bar, there's a lot of samples that are above the residential screening level. And so this is the type of analysis that we're going to be doing with the data in order to be able to come back and explain why we're making the conclusions that we're making about whether, which contaminants and to what degree they exceed the levels that are established by the regulatory agencies. And again, more to come in a couple weeks. Thank you, Dr. Quick.
All right. Thank you so much, Dr. Love. This was very useful, very thorough explanation of the sampling and methodology that's taking place right now, and very clear timeline of expectation for folks where we'll be, coming back to everybody with this very useful information. So thank you. Appreciate it very much. All right, we are going to move into our final speaker right now, which is Dr. Corey Koger from the U.S. Army Corps of Engineers. He will provide an overview of the soil tackifier being used as a stabilization measure in the fire-impacted areas. He'll explain what it is, why it is being applied, and how it works to reduce the spread of dust and debris while ensuring it's safe for both the environment and public health. Thank you.
Good evening. I'm Corey Koger with the Army Corps of Engineers, and as mentioned, I'm going to give an overview of the tackifier application process to limit fugitive dust. I'm not seeing the slides on my screen. There we go. Okay. So this is U.S. Army Corps of Engineers tackifier application. So this is for the California wildfires. Just want to note that this was through a request from the Air Quality Management District and the California Air Resources Board. That request came from the state of California for the Army Corps to provide public health protection through the application of tackifier. Next slide, please. So why is tackifier being applied to ash? We've heard a couple of references to soil tackifier. In this case, it's going to be applied to ash and debris. And the reason for that is to stabilize the fire damage properties and prevent the spread of particulate matter, which can pose health risks. The reason we're doing it now is that with drier, warmer, and especially during high wind conditions, application of the tackifier helps to ensure safer conditions for residents and workers. We also wanted to complete our phase 1 activities either through the US EPA or the Army Corps of Engineers to remove hazardous materials. Because the tackifier, once in place and cured, if you walk on it, it defeats the purpose and is no longer useful. So this is the time where we can actually start to apply tackifier. We are also only going to apply tackifier to properties that we've received a right of entry for. So this will not be all fire damage properties, but only for those where the Army Corps has received a right of entry. We currently have a little over 7,000. And of those, we've completed debris removal on 1,850. So we're looking at probably at the end of this, we'll apply tackifier to about 8,000 parcels. The tackifier application provides ash and dust suppression for approximately 6 months after it's cured. And at that time, the Army Corps anticipates that we'll be appreciably done with debris removal. Next slide, please. The tackifier will only be applied to the structural ash footprint as a public health protective measure. Looking at this figure, if you look at the outline in yellow, that is the area that the Army Corps would apply tackifier. That is what is eligible under the event for the immediate removal of structural ash. That's where the contaminants that were previously discussed reside for the most part. So once it's applied and it cures over about 48 hours, all of that will then be removed and disposed with the ash and debris off of each parcel. Next slide, please. So what to expect if you've provided a right of entry and we're going to apply the tackifier. The process is basically a specialized water truck that sprays the tackifier directly onto the ash footprint of the properties. That process takes about 1 to 2 hours per property. You can see in the figure there, they're applying the tackifier. I want to stress strongly that the reason that they're wearing protective gear is not because they're applying the tackifier, but because those workers are actually in the ash footprint. And that's one of our requirements to wear respirators and Tyvek suits. And that's a recommendation also for anybody in the public that goes into that ash footprint, wear protective equipment. As I said, the curing time typically is 24 to 48 hours. And it does provide some erosion control as well. So if there's a light rain, that tackifier will actually prevent spread of ash off the property. If it's a heavy rain, on the other hand, it may not stand up to that. So one of the reasons we're applying now is because we're out of the rainy season and going into the dry season. If we had applied with a large rain event, it may have made that useless. We don't anticipate any road closures. These are small trucks. As you can see, it's just kind of hooked up to a hose. The folks on the properties will not be requiring road closures. And residents who live in the impact area but adjacent to properties that have been burned do not need to leave their homes. And the reason for that is the safety of this product. It's non-toxic, biodegradable, and non-hazardous stabilizer. And it dries clear and odorless. So unless you actually step on it or touch it, you can't even see that it's there. The best way to describe this is it's a very dilute Elmer's glue. In fact, it's basically the same formulation as Elmer's glue without actual preservatives in it. So that's kind of what's going to be applied for stabilization. Next slide, please. So there are some resources about Tackifier application. There's a frequently asked questions site that was set up by the Army Corps of Engineers. There are some online resources about what soil tackifier is, where it's being applied, what to expect as we've gone over, and then the safety associated with this material. And with that, I complete my presentation. Thank you.
All right, thank you so much, Dr. Koger. We are now going to move into the Q&A section of the event tonight. We have received numerous questions. We're receiving those as they come in. We are going to do our best tonight to answer as many as we can. And so I'm going to go ahead and just get started. And Dr. Koger, if you want to pop back on here, I've got a couple for you that are related to some of the larger Army Corps operations, and we'll see if these are appropriate for you and if we can get any clarification. We're getting a lot of questions regarding operations at the Altadena Golf Course related to concrete. Specifically, if you could share with us what the safety measures are that are in place there to kind of protect public through the operations.
Sure. So the safety measures are very similar to what's being applied for each of the debris removal sites, in that we'll be using wet methods or misters or water trucks for dust suppression. It's also important to note that the concrete that's being taken to the Altadena temporary site, it has been tested, and therefore it's an inert material, so it's non-hazardous and non-toxic in and of itself. During the concrete processing, we will have air monitoring stations set up to show that we're meeting the air quality criteria, similar to what was presented by the Air Quality Management District earlier today. There will also be fixed and mobile labs in association with either the Air Quality Management District or some research academics that are going to be out there with their mobile labs. So we'll have the same level of protection that we do for the wet methods when we're doing the debris removal off the site, and then we'll be providing air quality monitoring data, which will be posted on the public health webpage.
Thank you so much for that information. Very, very useful. Just one other quick question that related to some of the cleanup that may or may not have been covered. What is the status, and maybe you could help out here, what is the status of phase 1 and phase 2 cleaning? Do you have an updated number on that? If not, that's all right.
So EPA has completed their phase 1 work, and they have demobilized. So they've processed all of the lithium ion batteries. That was the last bit that they had to do. For the deferred properties where EPA couldn't complete phase 1, household hazardous material, bulk asbestos removal, the Corps is nearing completion because those required more work to be able to make those properties safe to do phase 1. So we're nearing completion for the phase 1 activities.
Thank you so much. Okay, the next set of questions have to do with the rapid needs assessment. So if we can have Dr. Mahajan come on camera for these ones. Two sort of related questions. What was the initial goal for the rapid needs assessment, and how is it helping shape wildfire recovery efforts? And then sort of a related question, where will there be future opportunities for residents to share their needs?
Thanks so much for those really thoughtful questions, excellent questions. The initial goal of the needs assessment was really to give us collectively, those of us involved in response. And when I mean us, I don't only mean the county and the state and the federal government, but also all of those great organizations in the community that you know well that are helping with response, to give us signals as to what are the highest needs. Where are the needs the greatest that we need to make sure we're addressing them? One of the things I didn't have a chance to present today, but there is a lot of this data that we'll be presenting over the next week or two, is the subgroup analysis. So I showed you the overarching responses, but we've also taken a lot of these questions and looked to see how are people who have disabilities dealing with this question? How are people who may have households with children, young children? How are people who have households with seniors? Do they have different needs than what the average group that answered have as needs? And so we're also going to have a lot of groups looking to try and support the specific needs that subgroups like that may have related to recovery. And we know that the recovery assessment is like one spot in time. So it was done at the end of February and the beginning of March. And we want to address those needs as fast as we can with all of our partners. But there will be other assessments of need as needs evolve and change as we go through the recovery process. And so there'll be other times which there may be surveys, there may be group discussions, and there'll be other opportunities to talk about what the needs are. There are also a number of other groups outside of our task force that are doing surveys. Some of them are some of the universities. There are other local agencies, national agencies are involved in doing surveys, and you may be getting requests for surveys from them as well. And so we're hoping there's enough opportunity for us to understand from you all what do we have to prioritize to meet and help with. And then most importantly, we want to get that help to you. We want to make sure we communicate what are the available things to help, and then also identify what isn't available, but we need to find a solution. And so that's what the whole point of that was. Back to you, Dr. Quick.
Thank you so much. And that's a great segue into the next set of questions that are really, I think, best suited for our mental health partners on, whoever wants to kind of jump in and answer these. The question is, how is the county responding to the worsening mental health reported in the survey? And are there resources for these folks?
Thank you, Dr. Quick. I think that's an excellent question. As I mentioned in my opening comments, there are a number of resources that are available both at directly operated clinics, should you find yourself needing to reach out for services in your community. Also through Alter Health, they are offering a large number of services that are free, regardless of someone's insurance status. I think what a lot of people have struggled with is just where to go. And the 800 number for the department is probably the best gateway to call, but we do have support groups. There also been convenings at various clinics, especially in the impacted areas, where residents can go to receive support, because probably the number one thing is being able to share some of the challenges and struggles that you're having with someone else who's either been there or someone who can help you navigate through this really difficult time.
Yeah, thanks so much, Dr. Bonds. I just want to add other pieces and sort of say in different words what I've heard from Dr. Bonds and other members of his team and other groups. You can access these services for mental well-being virtually. You can access them in person. You can access them in a group virtual. So there are a number of ways in which one could try to understand, try to seek these kinds of services. And so maybe I can throw it to Joy from Alter Care if she wants to say a few words in answering the services that Dr. Bonds indicated they're providing.
Yes, of course. I'm happy to jump in. My name is Joy. I'm the program manager for Alter Care Line. Our counselors are currently providing peer support and disaster crisis counseling to anybody in LA for free. as part of the LA Fire Crisis Counseling Program in collaboration with CalHope and CDSS. Our counselors are currently at disaster recovery centers and doing active outreach in the community. So if you'd like to speak with one of our counselors, please feel free to visit our website. It's altercareline.com. It's also on the flyer that the Department of Mental Health has put out. And you can schedule a virtual appointment at a time as convenient for you, or you can also see our in-person locations and our support groups on the website as well, and feel free to pop by any of those.
Thank you so much for a recap on all of the available information. We do have a related question, just kind of stating, and I think reflecting what many community members may be feeling right now about being a bit overwhelmed by too much information. So that being said, I would encourage folks to utilize the, county recovery website as well as LADPH's website for sort of some a central place to get some of this information, including our post-fire assessment plan, which really allows you to kind of filter by what you're looking for to get that information. There's a lot of websites out here right now and a lot of data. So those could be a central points of contact to get some of that information. Okay, I'm going to move into a couple of sort of technical questions for some of our technical folks on here. We do have some ongoing questions related to, I think, air quality, some of which I think were nicely covered, but we do have a couple questions related to what will long-term air monitoring be conducted in the neighborhoods where these stationary monitors are? And is there a need for additional monitoring? So maybe if we could have South Coast Air Quality Management District just give a response to that one.
Thank you, Dr. Quick. Initially, we were planning to conduct these measurements for 30 days, but we currently are working with Cal OES and other agencies to extend that the sampling and measurements. As of now, I do not know a certain endpoint to this air monitoring, but for now, we're continuing all the measurements at all 5 sites.
Thank you very much. And a related question was related to, and I think you covered this, but maybe just to recap for some folks, are the measurements that are depicted that you nicely went through on the website, are those real-time measurements? Are those, mobile monitoring? What was that again?
So we started with mobile monitoring surveys. That was during the phase 1 debris removal. That was just to give us an idea about, the concentration levels and potential hotspots that eventually helped us identify best locations for stationary measurements. The stationary measurements are ongoing. They include both continuous measurements. These are hourly real-time measurements, and the concentration levels of PM2.5 and PM10 are posted every hour on our website. So these are near real-time. And then in addition to that, once every 3 days, we collect 24-hour samples for metals analysis and asbestos analysis. The results of those would take approximately a week before they're posted because they require chemical analysis in our laboratory and the contractor laboratory.
Thank you so much for that explanation and recap. All right, I think this next question is probably best for Dr. Love. And this is related to some wanting a little bit more specificity about what toxins are typically found in post-fire soil and ash. And these may be along the lines of dioxins, PFAS, or forever chemicals. There's a question about whether or not those are a concern. And then similarly, how long do these remain in soil after a fire?
So, based on other large fires, right, the primary contaminants that people worry about are heavy metals, including things like lead and asbestos and cobalt. There's a whole range of things that have been measured in other fires. There's also PAHs. PAHs form when things get burned, right? PAHs are sort of the char that forms in your meat on the grill. They form whenever organic materials get burned. And then the third is dioxins. Dioxins form, again, when things burn in the presence of chloride. they can react and form these different class of organic chemicals that are called dioxins. Those are really the top contaminants that historically people have worried about. All of them are fairly persistent in soils. They're not going to, they're not going to volatilize and go away. They're not going to degrade very quickly. And so one of the other reasons why people are particularly interested in them is that they will last in your soil if they're found. There's lots of other things you could look for, but those are really the ones that historically have been the focus of studies.
Thank you very much for that. We have a couple of cleanup questions, or I would say public health guidance questions coming in related to different items that may be found in household that I think maybe you can help with. Okay. Essentially, the questions are things like appliances, bedding, HVAC, stuffed animals. Is there general guidance on what can be cleaned, what should be disposed of, and what we should be thinking about when looking at that for folks that have potential either smoke damage or ash and soot in their homes?
Yeah, we talked about this a little bit on the last town hall. The guidance that generally is followed is that things that are solid surfaces, whether it be walls or floors or tile, right? Things that are solid can be wet wiped and cleaned that way. Things that are textiles, fabrics, are harder to clean. If they're small enough that you can put them in a washer dryer, right? That's a pretty effective method for cleaning, just like you'd have anything else on it. For things that are larger, it becomes more difficult, right? You could do a HEPA vacuum, you could do a shampoo scrub, but those bigger things that are harder, that are textiles that are harder to fit in your washer or dryer are the things that are the sort of most suspect for being able to get completely clean.
Thank you so much for that. We do have sort of a follow-up question I think is going to be best for Army Corps again, and this is related again to the concrete operations and just a bit more clarity, if you have any, on how the concrete has been tested and what it has been tested for. We've got some concerns about some heavy metal that may or may not be in the concrete. So maybe if you could just discuss again what the process was for determination of, the breakdown of that there.
Sure. So all foundational materials were sampled for asbestos because asbestos containing concrete cannot be recycled. And there is a requirement, or at least a push, to recycle as much material as we can to preserve landfill space. As far as the heavy metals that have been described that come out of burn building materials, the concrete is rinsed on site on each property prior to transport. So the dust that might contain the heavy metals has been removed, but prior to processing at the temporary debris site. Thank you.
All right, thank you. We are seeing some questions coming in that I think I'll just ask the question of myself and answer. There is some questions related to the advisory that Public Health has out right now that's related to the 250 yards. So let me spend a minute or two to talk about that. The Public Health advisory related to 250 yards of being within 250 yards of fire debris really is related to the understanding that we are still recommending from public health for folks to be aware of and try to limit exposure to fire debris, ash, and soot. If you are residing within 250 yards of uncleaned up properties where there's fire debris, ash, and soot, there is a potential for increased exposure to those ash, soot, fire debris, which may increase your likelihood of having health symptoms. So just wanted to be clear what that 250 yards is. It's a public health advisory, and it is still in place right now. Okay, I'm going to move back. There was one additional question that I think I had forgotten to ask Dr. Mahajan, and that's related again to the rapid needs assessment. There's a question about where can the public access or view those survey results?
Thanks so much. We are working on putting survey results online, and we expect to do that sometime in the next 1 or 2 weeks. In the meantime, we're sharing sort of summary level results like I shared tonight with lots of different community partners. And so that hopefully that will be making its way around to people to see, but we will publish it on our website sometime in the next week or two.
Perfect. And I'm going to add also that right now the post-fire assessment plan has information that's being updated by our partner agencies, academic partners, related to all of the activities that the larger sort of collaborative group, which are academic partners, other regulatory agencies. There is data and links to websites on the air, soil, and water. As those become available, they're updated. That's also available on the county's page. And fairly soon, we will also be getting up a public-facing dashboard to portray this information in a nice visual representation. So I'd really urge folks to go to the county website to get up-to-date information there as well. Okay, I'm going to move back into a couple other questions that we've received related to hold on. There's one more question that I think I'm actually going to go ahead and just answer as well, related to can the county provide clear guidance or safe cleanup procedures for standing homes, including personal protective equipment recommendations? I think that I would like to remind folks that, once again, lots of information out there right now, but on the county website, we have on there different sort of FAQs and guidance documents for different sort of situations. If it's a property that's, got damage in it, how to assess that. If there's a property that there may have smoke impact. So I'd really urge folks to go to the website and look at detailed information on that to get that up-to-date information on what that looks like. All right. One more question that I'm going to answer here is related to specific questions related to kids and special precautions that need to be taken for outdoor play equipment and what that might mean for kids. So I would also urge folks to go to the website to get that information. Do want to make a point for individuals, families that have small children. If you're living in an area where there are potential impacts for fire debris, ash, and soot, very important if it's the age of a kid that's doing a lot of touching things, hands into the mouth. Some of the things we recommend is making sure that you're cleaning outside play equipment frequently. And big one is making sure to take shoes off and coming back into the home, and washing children's hands frequently is a big one that's gonna help with that. Okay, I've got, I think, one final question that I'm going to direct at Dr. Love here, and then we'll check back in and make sure we've captured all of the questions that have come in. And this is really, I think there's a couple questions coming in about how to sort of assess for a need for professional remediation. Is there a given sort of standard that kind of necessitates you bring someone in, or what would be a recommendation of when someone should seek that professional remediation service?
Yeah, I mean, unfortunately, right, everybody's home is a little different in terms of where they're situated, how big, the shape, things like that. Individual parcels really need to be assessed on a case-by-case basis, and you can get an environmental professional to come in and give you an estimate and a recommendation on what they think is appropriate. The data that we're collecting hopefully will help inform that in terms of also, what is reasonably expected based on locations and parcel conditions, as well as some of the leading contaminants. But ultimately, each parcel would need to be evaluated. If you're worried about it, each parcel would need to be evaluated specifically for the conditions that they're in.
Thank you so much, Dr. Love. Okay, so I think we are nearing the end for today. Once again, want to encourage folks to check out county resources for this. Stay tuned. We will be coming back with additional information, including the results that Dr. Love has spoken about today. I want to offer a very, very sincere thank you to all of our panel members today for providing this information, and we will be back in touch with another town hall shortly. Thank you.